Did you know that there are times that you should actually avoid getting cataract surgery done? Hi everyone, my name is Dr. Saya Nagori. I'm a board certified ophthalmologist. I'm also a fellowship trained glaucoma specialist, and you're watching the iFacts.com channel. Today we are getting into the 3 biggest reasons that I think my patient should avoid cataract surgery. And the last one may surprise you, so be sure to stick around. Number 1 of 3, you should avoid having cataract surgery if you have a chronic disease that is not under control. For example, if you have really high blood pressure and your blood pressure is out of control, then it may not be safe for you to undergo anesthesia, which you do need for cataract surgery. While there's not a lot of anesthesia involved, because cataract surgery is considered an elective procedure, meaning it's almost never an emergency, you want to wait and get all the other diseases under control so that you not only have the best outcome for your eyes, but also so you don't have complications during the procedure itself. Now, of course, before you have surgery, you will get paperwork to go see your regular doctor, your primary care doctor, maybe even a cardiologist if you need that, to make sure that you're safe to undergo this procedure. And it's really important that we get all the right doctors involved if you do have several chronic diseases to make sure that your health is optimized before going into something like cataract surgery, which can, in most cases, wait. Another important disease to mention is diabetes, because if your blood sugars are up and down and they are not under good control, you're going to want to get your primary care doctor or maybe also an endocrinologist involved so that we can get really good diabetic control before you have surgery. When diabetics have cataract surgery, they are at higher risk for getting some swelling in the back of the eye after surgery. And then they go through surgery expecting their vision to be much better, but then the swelling from the back of the eye can actually cause visual issues. Of course, every patient is unique and different, and there are, of course, exceptions that are made, but in general, you want to optimize your health before going into cataract surgery. And if your health is not optimized and the surgery is not an emergency, I would avoid the surgery until you can get your chronic diseases under good control. The second reason I might tell someone to avoid having cataract surgery is if they have really important travel coming up. Now, you may be thinking, but my doctor told me it only takes a day or 2 to recover from cataract surgery and that I won't be able to do heavy lifting for maybe a week or 2, so I should be able to go back to work. And your doctor is not wrong, and cataract surgery is quite safe and the risk of complications is very low. And when it comes back to going to your normal life, yes, that happens pretty quickly. But what if you fall into the small category of patients that ends up with a complication and you need to be seen more often than someone who's had an uncomplicated situation? Maybe even it's just a little extra monitoring because you've had more inflammation and it's not even a big problem, but they do want to see you back. Or it could be something more serious like an infection that needs to be treated immediately. Either way, if you have scheduled your cataract surgery before your son's wedding, it's not a good time to do that because you don't want to have to miss important life events or miss important travel because you have to be in the eye doctor's office. So it's always best to schedule cataract surgery when you have a good couple months ahead of you and a fairly clear schedule to actually take care of yourself and not worry about other things. Finally, number 3, I see so many patients that have cataracts, but they don't need surgery. In fact, having a cataract is so common. It is a normal aging change. If you live long enough, you're gonna get a cataract. It's like getting white hair, like all the white hair that I have right now. So it is normal. It's a normal part of life. And just because you have a cataract doesn't mean you have to have surgery. That cataract should be affecting your life and your vision for you to have surgery. So a lot of my patients, there's actually no urgency to do the cataract surgery. And so some of the things that we talk about when we discuss whether they should have cataract surgery or not, number 1 is their vision. How are they seeing the chart? And number 2, how are they driving? Because if they're having difficulty driving, and we can do something called a glare test, where their vision may actually get much, much worse when they have glare. And that could be a reason to have cataract surgery, especially if you're someone who drives frequently and it's making your driving dangerous, putting you at risk, or making you at risk to someone else on the road. those are good reasons. But if you have a very mild cataract, you have good vision, you feel great when you drive, you don't really have issues with night vision, or maybe you're someone who doesn't drive, maybe you live in a big city and you generally walk or take public transportation, you could probably wait to have cataract surgery. Now, there is a caveat. Of course, you don't want to wait super long, and I do talk to patients about this because the longer you wait to have cataract surgery, and if that cataract gets really, really dense, then the surgery becomes a little bit more challenging, because in those really dense cataracts, the surgery can take longer. It means more energy is going into the eye, and that can cause problems for the cornea. It also makes the surgery a little bit riskier than when it's not quite so hard. But certainly there is a middle ground where you may want to wait if the cataract's not bothering you, you're not having difficulty seeing, and there's really no lifestyle reason, meaning you need to drive at night, to get it done. Now, I say all of this because it's so important that the patient is also motivated to have cataract surgery. It is in very few situations where I would tell a patient, you should really consider getting this done. And usually that situation is when their vision is hovering around 20/40 and they drive a lot, because the next time they need to go and get their driver's license renewed, they may not pass the exam because of the cataract. So being able to drive safely is one of the reasons that I will talk to patients about, hey, I know you don't feel like it's bothering you, but your vision is not really that good and it's getting to the point where it's not safe to drive. And so in those situations, I will sort of educate the patient more. But certainly if they want to wait, then that is their choice. But if you have good vision, you don't drive, or you're not bothered by it. When I trained in New York City, and when I worked in New York City, most of my patients didn't drive. They took public transportation. And so they didn't really need to have cataract surgery as early as maybe some people who do drive. So everybody is unique, everybody's situation is unique. So it's really important to have this discussion with your doctor, address your personal concerns, and make sure that you feel good about the decision that you're going through. And you feel good about the decision about having cataract surgery. Because yes, it is very, very safe and very low risk of complications, but certainly you want to go into it with a good reason. I don't think it's appropriate to do procedures when there's no really good reason, especially if there is an alternative like waiting. What questions do you have about your eyes or cataracts or glaucoma? Be sure to leave them in the comments below, and I'll try to make a future video on it. If you found this helpful, remember to hit the like and subscribe button, and I'll see you in the next video. Thanks for watching.